Okay, kano. Nestoa kouk Makiinima. Kidaksi akkiina pskuhpinnaanan hudansta pihpienukka ammukka maani päästsemis. Iksi kaika puutta kiemuksia puuttumukiksi. Hässukinnakiaks. Houkeamuksi jäspumpistääksi. Iksi kaukan aika kimaa oukin sekutsiiskaas. Näksei puma pion kidaksiina pskuhpinna. Nakoutstiukaaki. Nakoutstiukaaki. Aamuhei niin se tappio. Akais sen juutsemme. Kiksi tonne tsikkamaa puutsemia miksi hässukinnakiaks. Houkeamuksi ei tuuttotomapsiksi. Onko se hätsinä puutekiksi. Sitä muhvista pumanta putuitsikatu. Se tuut siinä pskuutspinnaan nuhka kaaksta tsikiäkstsikku. Sitä muhvista päin. Sitä muhvista putuitsikatuun ja nuhumuuksi. Maksuvanitstis. Kan ikä eikö kohtuu tutama pioniksuukkua. Niin tappi eikö kohtuu tutama pio. Akumannestais se nuhumuuksi. Hässukinnakiaks. Onkin muuksi. Ita poutakiks sukinappi. Akumannestais seoksa. Akit kuhkitkiapaapous. Onkin kamaksa paaki nohohskuuk nohkiitsemmiksi. Onkin ästä mikapstsemmik. Aamuski tajuhtua iksi poja peistä matsuukia. Kennohki taagat siinä pskuukua. Kitaagat siinä pskuukua niksuukua. Se kannist siitäkin. Kamumanista aika kimokki. Aksas seoksa. Kamumanista aika kimokki. Aksaissin juutsisi. Mataksista puhua käyttä pionnohki issin juutsimiksi. Kaaksanaukat siis kaanaa piokaakin. Kam seis seokaten. Kam se kiistonnon. Kam suapi seokat. Se miksi tauaan niispia. Haka niitsi. Ani keikitä piis kaanaa pio. Niksuukkua. Onko ne taksaa piippui. Muksia kun katsit siippui ja mä äsukinakin oikein mua aiskuhtua makuks kaasatuksi. Onkin miksi kun tui miksi äsukinakin utan puutaksua panukäksiksena mä kun katsit se niippui. Okei, känno. We have received confirmation from the Blood Tribe Department of Health and from the federal and provincial government that there is one confirmed case on the blood reserve as of today, April the 29th, 2020, at approximately 11:15 a.m. Of course, our health officials, our professionals are working quickly to notify those who have come in contact with this person. We offer our prayers for them and their family. We also ask all Blood Reserve residents and members who are thinking of returning to the reserve to stay home or where you are at. As our health professionals complete their contact tracing and notification, it is so important that we follow the very important instructions that we have received by our health professionals. We continue with those practices. If we do that, we will hopefully stem the spread of this very dangerous virus. So I will ask our Director of Emergency Management, Rick Soup, to again go over the public alert that has already gone out. It has already gone out, and I believe the other media will be involved in our announcement today. And we hope to have announcements every other day. So please listen to the important information that will be shared by you, by Rick, by Dr. Esther, and of course by Punukaksiksinam, Martin Heavyhead from the Department of Health. Kenne gedochanis tukanis tupua nikso kua ika kimak. Samomanista is seo kamuksi ni teistä matsuutspi. Ni teistä matsuutspi. Okea kitsi koksi kimmaava muhka issinjuutsema muhka mani päästsemis. No kupatsemu iskak. No kupatsemu iskak. Oki kuututama pio nikso kua kistunnoon. Ki päätä pioksennoon. Ki päätä pioksennoon nanne nukaa tabi piksop. Nukaa tabi piksop. Ki entikei. Istakkiutataks kuna taapsop nohkiitseitsatapia. I manista tästio mohkiistunnoon ki päätä pioksen ki tatsemuiskan. Ki tsiipuoksennoon. Ki taaksi amma rikka amaakin tukstakio kiaksaa piipuottu. Hanja.
Oki Gana and all listeners, I am Rick Soup, Director of Emergency Management and Blood Tribe Senior Executive Officer. I will start off by reading a prepared statement regarding COVID-19. As Makiinima has mentioned, we have received our first confirmed case on the blood reserve. The Blood Tribe has monitored the COVID-19 pandemic closely and worked diligently to prepare our community in fighting this virus and will continue to work as a team along with Blood Tribe Department of Health and all surrounding communities. We ask the community to remain calm, and if you have not taken the necessary measures to prevent contraction and the spread of this virus, to begin now by doing the following. Keep a physical distance of 2 meters or 6 feet apart, away from anyone outside your home if you need to be in public. Wash hands with soap and water for 20 seconds or use hand sanitizer. Cough and sneeze into your arm. Avoid touching your face, eyes, nose, or mouth with unwashed hands. Clean and disinfect areas that are frequently touched at home or at work. Avoid close contact with people who are sick. Stay at home and away from others if you are feeling ill. We also ask to remember your compassion, respect, and concern of the way of Ghana, to support those that may be going through this difficult time. In this time of uncertainty, we want to assure you that our healthcare professionals, frontline workers, custodial staff, leaders, decision makers have worked around the clock to prepare our people for this. We have on-reserve emergency social housing available and finalizing plans on a few others to help with the overcrowding problem that we face on the reserve. Those who do not have symptoms of COVID-19 can go to. For elders, they can go to the Kainai Healing Lodge. Please call 403-737-3757. For singles or couples with no children, you can go to White Calf Hall starting on Thursday, April 30th. Please call Blood Tribe Recreation and Parks at 403-737-3868. We are arranging for a shelter for single families, which should be finalized in the near future. We will provide those details when complete. We require your cooperation to follow the travel restrictions and do not go anywhere unless absolutely necessary. We are all in this together, as the safety of our Blood Tribe community is our top priority. If you are experiencing any of the COVID-19 symptoms, even mild, such as fever, cough, sore throat, runny nose, nasal congestion, shortness of breath, difficulty breathing, please call 403-737-8411 immediately. Information will be provided as received through the Director of Emergency Management Office. Now, I'd like to mention that the Emergency Management team has prepared this booklet, has very valuable information regarding the Blood Tribe COVID-19 response. It gives guidelines to follow if you have COVID-19 symptoms, as well as a flow chart, whether you have symptoms or not, where to go and what services are available. So I'll quickly list some of these. It instructs what to do in regards for home isolation, how to care for a COVID-19 patient at home, the White Calf Hall and Kainai Healing Lodge Center site protocols and procedures, the clinical isolation at Flamingo Motel in Cardston, mental health, Kainai Wellness Center, what programs they have available, as well as Ghana Children's Services Corporation, Blood Tribe Housing. It lists all the important Blood Tribe service phone numbers, as well as our website, bloodtribe.org, Last Star Radio 89.9 FM, our Facebook Blood Tribe Communications page, and our print news media, Blood Tribe News. Thank you again for listening, and we now urge our members more than ever to follow the advice of our healthcare professionals, medical practitioners, our leaders, and emergency management team. Please stay home, stay safe, and stay healthy. Thank you.
Hoki niksuukua. Hoki käen ainakaan no hait uhtsim. Ognisto kokakia punukaeksiksina. Niksi esukine käpuutikiksi täitsin uppi. First, I'd like to thank the men and women working for the Blood Tribe Department of Health for all that they do. They are dedicated to serving the members of the Blood Tribe and are working tirelessly to achieve this goal. In Alberta, there are 4,850 cases, confirmed cases. There's been 1,800 that have recovered. There have been 80 deaths, 4 in the South Zone. Calgary continues as the hot spot with 69% of the cases. 685 in the South Zone. Brooks are now approximately at 623 cases. There are 5 active cases in Lethbridge. The South Zone represents 14% of provincial cases. The South Zone has surpassed the Calgary Zone in cases per 100,000. That's the rate of infection in the South has surpassed Calgary. Kainai, Cardston, there's 1. Brooks is seeing a significant amount of community transmission because of multifamily homes and overcrowding. Community transmission describes the situation where a person is infected by the virus, but they haven't traveled recently or been in recent contact with other confirmed cases. There are also reports that the community of Brooks failed to follow the recommendations of the Medical Officer of Health, community events, church services, and social distancing. If Blood Tribe relaxes the measures that have been put in place, the Reserve could easily follow Brooks into a large-scale outbreak. Recently, a cross-section of individuals were tested in Brooks. AHS found that 14% of those swabbed and showed no symptoms of the disease were positive for COVID-19. Across the province, the number of hospitalizations due to COVID-19 has slowly risen over the past few days, reaching a total of 87 people being treated in hospital Monday and 82 on Tuesday. Tracking. When a positive result is detected, our Blood Tribe Department of Health Community Health team will track contacts to ensure appropriate public health measures are taken. Blood Tribe Department of Health, working with our partners in other jurisdictions, will ensure that proper tracking is performed both on and off the reserve. We are very fortunate to have an excellent relationship with AHS in the South Zone and our First Nations and Inuit Health Branch colleagues across the province. Privacy and protection of information. We need to be reminded that all information related to an individual who is or was infected with a communicable disease must be treated as private and confidential, and no information should be published, released, or disclosed in any manner that would be detrimental to the personal interest, reputation, or privacy of that individual. It needs to be stated that any inappropriate access or disclosure of personal or health information of an individual receiving care constitutes a privacy breach and is in clear violation of the law. These are uncertain times. We need to remember that regardless of what's going on, privacy and the protection of information is paramount. We need to respect each other and to demonstrate compassion and kindness. Sharing information that is not yours can be harmful to the individual and to the community. Modeling. The government of Alberta has introduced a new low modeling scenario estimating 298 Albertans will require hospitalization and 95 will require critical care when the virus reaches its peak. If current trends continue, this scenario will become the most likely scenario for Alberta. Updated modeling scenarios continue to estimate that Alberta's outbreak will reach its peak in late May. However, the number of Albertans hospitalized at the peak of the virus is predicted to be lower than originally estimated. This reflects Alberta's experience over the past few weeks in the proportion of cases actually entering hospital and intensive care units. COVID-19 in First Nations communities. Rick Wilson, Minister of Indigenous Relations, announced Monday at the daily provincial briefing that 14 cases have been confirmed in Eden Valley and another has been found in Morley. We cannot let our guard down at this time, and we need to learn from the COVID-19 outbreak in the South Zone, which has resulted in 2 deaths in the community of Brooks. Our condolences go out to the families that have lost loved ones at this time. I'm also making you aware that one positive case was just identified at the Bovary plant in Fort Macleod. Blood Tribe Department of Health Community Health has reached out to our Medical Officer of Health for contact tracking. We urge all members to adhere to those public health guidelines. All Albertans have a responsibility to help prevent the spread. Take steps to protect yourself and others. Practice social distancing. Stay home and away from others if sick or in isolation. Practice good hygiene. Wash hands often for at least 20 seconds. Cover coughs and sneezes and avoid touching your face. Monitor for symptoms such as cough, fever, fatigue, or difficulty breathing. Physical distancing involves taking steps to limit the number of people you come into close contact with. This is not the same as isolation. You do not need to remain indoors, but you do need to avoid being in close contact with people to protect yourself and others. Keep at least 6 feet from others when going out for groceries, medical trips, and other essential needs. Limit the number of times you leave your home for errands. Try to limit grocery store visits to once a week. Try to have only one person in the household do the shopping. Try to shop at less busy times. Order online to have groceries or other items delivered if possible. Go for a walk in your neighborhood or park while maintaining distance from others. Avoid overcrowding in elevators or other enclosed spaces. Follow Alberta's mandatory restrictions on gatherings. Wash or sanitize your hands after touching communal surfaces. We are recommending that all staff members wear appropriate masking when social distancing guidelines cannot be observed. As I said earlier, there has been a case that tested positive at Beaufry, and we know for a fact that there are employees there from the Blood Reserve. And everybody is asked to start wearing masks when you can't social distance within meetings or any time you can't do that. Otherwise, it's okay. Blood Tribe Health has operated all during this pandemic as though it was already here. And I think at this point, we now know for sure that it is here. But the testing that was done in Brooks identified that 14% of those people who weren't showing symptoms were positive, and but they didn't have any symptoms. So this is just, for everybody to realize that there may be people walking around without symptoms. So thank you very much.
I will speak English now. I just want to add to what our leaders have said. Number one is I want to ensure that people remember Gimmapi Bitsini, which is a kainai value, where we respect and care for each other. And that is what is going to get us through this COVID crisis, is the caring that we have for each other. I want to remind people that our elders and our children are our greatest treasure. And the work that we're all doing together is to save and protect those people who we treasure the most. And of course, everybody is treasured, but we really need to protect those vulnerable people. The second thing I want to say is there's a great amount of planning and work that's gone into bringing Kainai this far. So we have, as Rick and Chief Roy have mentioned, and Martin, there's a great amount of work that's being done. We've put out a brochure regarding how to home isolate. We've done an extensive amount of planning on sheltering, because we know our people often have crowded situations or are homeless or are not able to shelter in a home. So we have a number of shelters that are now up and running. The first one is the non-vulnerable and the non-symptomatic, which will be down at Whitecalf Hall. There are arrangements made for Whitecalf Hall, and we're hoping that people will stay once they have registered and been admitted to Whitecalf Hall. We would like the activity to stay within the hall so that we can contain and save and protect those people that are in that shelter. The third shelter that is up and running is Kainai Healing Lodge, and that is for the vulnerable and for our elders. That is to protect them from anything going on in the community. That has been up and running for over a week now, and there are elders in that facility. There's a number provided by Rick on how to be admitted to that facility, and we hope that our elders and our people with immunocompromised conditions actually go there and are safe there, because those are the ones that have the highest risk of mortality if they get the COVID. And then we also are working on Flamingo Motel has been identified as our quarantine unit, and it is under the Blood Tribe Department of Health, which has been quarantining individuals who are either COVID positive or suspect positive to help them quarantine or isolate in a safe and comfortable environment. The fourth area that we're working on is we're looking at trying to continue to help families in a situation where they're not able to be in a safe home isolation environment. So the schools are now working on preparing that for our community. So we've done an extensive amount of work, and now we're launching that. We know now we have our first case, so we will be active in helping each other out. I just wanted to say that I'm very proud of our people across our community. Everybody has done such good work and hard work to protect our people and our community. And at this time, I want to say that we have a number of people working around the clock to do that. I do want to address the behavior of COVID because we know that it's highly infective, and we want to protect our population from death or fatalities. So I do want to remind people that for the first part after becoming infected with COVID, the symptoms are not noticeable, and some people will not develop symptoms for at least 6 to 8 days after becoming infected. And so that is why we have the 10-day isolation criteria that we would like people to home isolate for 10 days. But the most dangerous time is that time when people are walking around with the COVID virus and maybe infecting a number of people in their travels. So it's very important that we continue to do the self-isolation, the hand washing, the social distancing. All of those, we need to be very vigilant about how we do that. I'm recommending that we wear masks outside the home to protect the people out that we're visiting or the people around us, because that helps to contain it within ourselves. So I'm really recommending either the medical masks that are being provided and that the tribe has purchased, or the sewn masks that a number of our seamstresses have been sewing across the community. That helps to contain the virus, and that's what we need to do. I would also like to just reiterate the individual protection, and that is the social distancing of 2 meters or more, the hand washing or use of hand sanitizers. And as I said, I would like to recommend masks when people are out of their home. And if you have an elder or somebody that's immunocompromised or children in the house, I would recommend that the person who has been going out for errands wear a mask inside the house as well. And we also keep our environments clean with sanitizers, especially the doorknobs, any of the handles that are touched, the countertops, and places in the home where multiple people are touching. It's important to remember that you stay inside your household. We are still experiencing people that are visiting house to house, and that's how this transmission can become community spread. So it's important to stay within your own home. I've seen a number of people with birthday parties and other things going on, and it's nice to see the celebration, but it would be best to have the celebration via FaceTime or people visiting from across the window. We know that many people are visiting their elders from outside the house, which is fine. But we need to remember that if this becomes community spread, that's how we're going to spread it, is visiting home to home. I also advise that no two households or people from two different households do not ride in the same vehicle. We are doing that a lot, and that's the way of our people, is to share rides. But at this time, I would like you to be very careful about that, because that also is a way that can be spread. Start to be careful and conscious of your community contacts. That will help our community health people to develop their contact lists if we have more people who become infected. So the contact tracing would be much faster. And the last thing I want to say is do not panic. We have done a lot of work here with Blood Tribe to help support our people and protect our people. We don't need to panic. We can get through this with the help of each other and being respectful and careful of all of our people. Thank you.